I'm Lauren Darr, Publishing Director for Left Paw Press, and I also happen to be married to Dr. Tinkle.
And I'm Dr. Brad Tinkle, clinical geneticist who specializes in connective tissue disorders, including Ehlers Danlos Syndrome, which we'll talk to you today about.
So, since you brought it up and you are a world-renowned expert on Ehlers Danlos Syndrome, also known as EDS, can you, for those people that don't know what EDS is, give us a quick explanation of it?
Sure. EDS is a connective tissue disorder. That means the tissue that sort of holds joints, ligaments, those kinds of things, mechanically acts differently. And so a lot of people end up being, quote, double jointed. Their joints move more than they should. That can cause dislocations of joints. That can cause joints to feel like they're moving in and out of place when they should. Ultimately, what happens for these individuals is throughout the day, they end up having a lot of pain associated with it. So it becomes a chronic pain condition.
So, also, can you give us some stats as to what the population in general, what percentage would have EDS, and also maybe some of those gender-specific statistics?
So often this is a genetic trait that can affect boys and girls equally as children, but there is a hormonal influence, and so often after puberty, the males, the boys, tend to actually improve in their joint symptoms, but the females start having more chronic daily pain. And so often when we see individuals with a lot of joint pain, about 80 to 90% are actually females.
So when you have new patient visits, because this is something that you and I have had discussions about, can you tell me what that typically looks like for you?
So often when coming to a geneticist or a rheumatologist, these individuals spend 45 minutes to an hour and a half with the doctor. But most of the time they get to a person who is knowledgeable about EDS, they've seen multiple specialists. And so when they come in, they're bringing x-rays, they're bringing stacks of medical records. And so in 45 minutes to an hour, it's difficult sometimes to actually go through all these medical records, talk about the history, do the exam, and continue forward by talking about how we can help these individuals.
So, and that's one of the main reason for us talking about and coming up with this ideal together about having this project called My EDS Journey, which basically is a journal, but it really goes beyond that. It's something that we haven't seen anywhere, frankly, out on the market. We think it's a great idea. That's part of the reason for starting this project and seeing the viability of it, because it goes beyond just being your typical journal. It includes other information in it that you are compiling.
Yes. So a lot of times I think the inspiration had come from those patients who would take these large amount of medical records and they'd have them in binders. And some of these are 3- and 4-inch binders. They're very organized. But what we need most of the time is a fairly concise summary. So what we wanted to do was to sort of provide prospective patients, individuals who may be affected with EDS, some questions, some questionnaires, some forms to sort of fill out that would make that visit far more productive when they go see other healthcare providers.
So let's talk a little bit about what is in there. Let's talk about the table of contents for the EDS, My EDS Journey journal, to give some explanation as to why this goes beyond just being a journaling project. So for starters, it will have in there an area for emergency contacts.
You also want a pretty long list of all the doctors that's involved. EDS can affect a number of different organ systems and etc. And you want people on the same page because you don't want one doctor prescribing something that may not work well with what the other doctors are trying to do. So you want to make sure that communication actually goes out to all the doctors that are involved in the care. And it's important as a physician for me to know who do I need to be contacting, both by phone number, fax, and regular mail address.
So that's why there's the doctor list in there, and of course there's a section for having a list of allergies, and then also you want to include the medication list?
All medications, that includes prescribed medications, over-the-counter medications like ibuprofen or Advil, but it also includes any kind of herbs, other type of homeopathic kind of supplements, because they potentially can interact with some of the other medications that a patient may be prescribed.
And also in there included several sheets actually will be a sheet that Dr. Tinkle actually has developed himself, which is called a current problem / diagnosis sheet. And this is something that can be filled out each time the EDS patient goes to see their doctor, so that the issues pertinent right now at hand can be addressed. And that's the reason why there will be several copies in there. But of course it could be copied. Do you need to expound on that?
So there are going to be particular issues that we want to sort of address, and sometimes it's important to make sure that we know all the different diagnoses, we know what kind of problems are going on. Sometimes I can treat one symptom with a medication, but if I know there are other problems, sometimes I can make my choice of how I do that intervention to benefit more than just the one thing I'm focused on. For example, headaches. I can give medicines that help with headaches and help with sleep. So those are important things to sort of consider. The other things, we want to make sure that there's a lot of historical data that's there. That might include MRI data, other types of diagnosis, because that's important information to sort of keep at hand. We also, in the published literature, there's a fairly good screening questionnaire which sort of helps, because joint hypermobility tends to decrease with age. And so if you're a bit older, if you've had injuries or things like that, you may not be very flexible. But it's important for that healthcare provider to sort of take that into account. And one way is a screening questionnaire which has been published in the past for joint hypermobility syndrome.
And you also want to, very importantly, have in there a history of surgery, right?
Yes. A lot of these patients have joint surgeries, other types of surgeries, so it's important to sort of know. We also want to have legal information that's there.
Right. Just some basic legal information that you've come across over the years from,
Yes.
from attorneys. Obviously, neither of us are legal advisors, but with EDS there are some specifics that might want to be considered by someone that is afflicted. Of course, there will be plenty of journal pages so that you can share your own journey in your My EDS journal. And then you also have a section that will have disability information.
So a lot of times as patients continue to have chronic pain and etc., they struggle with not only just household activities that includes getting ready in the morning, taking care of the kids, taking care of the house, but with work also. So a lot of people who really struggle with this cannot maintain gainful employment. And so that's where the question of disability always comes up. A lot of people fail in their attempt to apply for disability, mostly because they're not prepared. So we want to help you by providing some forms, which I think are very good for you and your healthcare provider to think about, which is called a functional assessment form, and we'll include that in there. Along with that will be some other, I think, fairly useful resources to be listed.
Right, a comprehensive resource section that Dr. Tinkle has developed over the years. So when we discuss this project, there are people that kind of prefer to do things in the electronic age, and there are folks that prefer to have things printed. And that's why we have also decided, as part of this overall project, to have this in the form of both a fillable PDF and an 8.5 by 11 a hardcover printed bound book form. And we have a pretty aggressive release schedule.
Yeah, we'd like to release it in August in time for the National conference, patient and family conference for the Ehlers Danlos National Foundation in Northern Kentucky.
Right, but we've done it before.